I'm Dr. Kirsten Lewanid coming to you from River Valley Chiropractic, where we teach you to move well so that you can live well. And we get a lot of patients that come in and say, hey doc, I have sciatic pain or sciatica. And often, you know, it's not sciatica because sciatica is actually a very misunderstood, it's not really a diagnosis, it's more a set of symptoms that describes when there's irritation on a nerve. The sciatic nerve, which runs from the low back, down across, down the butt, and down into the leg. It can go all the way down the leg. And so it's an irritation of that nerve that can be a referred pain or a radicular type pain. And that's what true sciatica is, what we call sciatica, but it's a set of symptoms. So we need to find the underlying cause. So when they come in and they have, you know, butt pain or pain down into their thigh, they're saying, I have sciatica. And it may not be sciatica. So one of those underlying causes or one of those diagnoses that we find that has to do with irritation on the sciatic nerve is piriformis syndrome. And this is something that we actually see more commonly in our office than a true sciatica, is a piriformis syndrome, which is an irritation, again, on the sciatic nerve. So what is piriformis syndrome? Well, this is when you have inflammation or spasm in the piriformis muscle, which is a muscle that's deep in the butt underneath the glute muscles, that has spasmed up or gotten inflamed and is causing compression on the sciatic nerve. So what are some things that you can do at home to help relieve sciatica or butt pain, low back pain that's going into the butt and down the leg when that piriformis muscle is tight? Well, today we're going to do three simple exercises that we're going to use the foam roller for. So if you have a foam roller at home, you want about a medium to firm type foam roller that can really compress into the area. So we like to get ours, we get ours off of Amazon. This is about a 3 foot in length, 6-inch diameter foam roller. So we're going to do some self-myofascial release. What does that mean? Well, we're releasing the fascia ourselves that's around the muscle. So you can use the foam roller to release this tight muscle fascia around a muscle, and we're going to spend about 20 to 30 seconds on a spot and anywhere from 2 to 3 minutes aside to really release that. You don't want it to be too painful, but it should be like kind of like getting a deep tissue massage. That type of level of pain would be about what you want to go to. You don't want to go any more than that, and you don't want to do this every day. You would want to have a day in between, allow that inflammation to settle down before doing it again. But if you're having a lot of pain in the butt or in the piriformis from the low back, so this can be low back pain that goes into the butt and the hip and down into the leg, then this is 3 exercises you can do on the foam roller to release that tight fascia around the muscle to help give you some relief. So we're going to start with a figure 4. So it's exactly what I'm saying. It's a figure 4. You're going to make a figure 4 with your legs. So in this case, I'm working on the right piriformis muscle. I'm going to support myself behind the foam roller with my right arm. I have my leg across in a figure 4 position, and the pressure is on that piriformis or on the butt muscles. And what I'm going to do is I'm going to roll around and find the spots that are sore. And so you find a spot that's super sore or tight, you can stop in there, and then you're going to focus on that spot, rolling in that spot, releasing the fascia with the foam roller for about 20 to 30 seconds. You're going to stay in that spot. And then after you've done 20 to 30 seconds, you're going to move around and you're going to find another spot. And again, 20 to 30 seconds. And you're going to repeat this in that area for about 2 to 3 minutes, working on the piriformis muscle on the right side. And then you would switch and do the other side. So you would put the left arm behind and get the left side, okay? So that's the figure 4 stretch for the piriformis muscle on the foam roller. Next, we're going to do the pigeon stretch. This is a common pose that you hear in yoga and different things. So you're going to get in the pigeon position like this. This is more for the upper area of the hamstring, lower area of the glutes that we're focusing on. You're going to get your back leg straight behind. And then again, support yourself. You don't want to fall. And again, you're going to find those sore areas in there. Find a spot and then roll it back and forth, 20 to 30 seconds in that spot, moving it around, again, spending 2 to 3 minutes on each side. Now our third one, so this was the pigeon pose. Our third one we're going to do is we're going to work on those hamstrings. That makes sense, right? That sciatic nerve's coming down from the lower back either through the piriformis muscle or under the piriformis muscle. It's different anatomically in different people, but through the piriformis or under the piriformis down into the leg. So let's work on where that's coming down into your leg. Let's work on the hamstring a little bit. So we're going to do a hamstring myofascial release. So I'm going to start on the right side. So my right leg is down, my left leg's on top, and I'm using the weight of my body to roll down the hamstring. And then again, when you find a spot, you're going to spend 20 to 30 seconds in that spot, rolling the fascia to release that tight fascia around the muscle that's in spasm. And then you can work your way down as far as you can keep your balance. You can go down to the knee if you want. Working on those tight areas and releasing the spasm in those muscles, the fascia, the tight fascia around the spasm muscles that are compressing on that sciatic nerve as it runs from the low back down into the leg. So these are 3 simple foam roller exercises that you can do at home to release that tight fascia around the spasm muscle, primarily the piriformis muscle, causing spasm onto the sciatic nerve. But again, we were focusing also on the top of the hamstrings and down the hamstrings because that's the path the sciatic nerve runs to relieve some of that irritation, that sciatica that you're feeling, that low back, butt pain, into the leg pain. This can also give you some relief even in the low back because again, if these muscles are in spasm or are tight, they're pulling on your low back as well. In addition to this, I would recommend seeking out your local chiropractor. Chiropractic is one of the best conservative methods for piriformis syndrome. There are things that we can do with the alignment of the spine and the lower back, the sacrum, that area to help also provide relief. And if the nerves from the spine are not functioning completely normal because there's misalignment in the spine, and that's causing the muscles to spasm, which is then causing spasm on the sciatic nerve, you can see the connection there. So that's about finding the underlying cause. So if there's misalignment in the lower back or in the sacrum, and that's the underlying cause for your piriformis syndrome, getting that corrected by a chiropractor is also going to help you find relief from the sciatica or piriformis syndrome. I want to thank you for joining me today. Please like if you found value in this video and share with your friends. Also click subscribe and the notification button at the top if you'd like to see our future videos as we release them. If you have any questions regarding this video or anything else, feel free to pop that in the comments below. Again, thank you for joining me today. I really appreciate it. Have a great day. Dr. Kirsten Liwanag coming to you from River Valley Chiropractic. Bye-bye.